Welcome to www.staxi.com. Today's topic, bariatric wheelchair rental is useful for short-term care. Bariatric wheelchairs are designed for people who must spend most of their day in a wheelchair. Bariatric chairs are usually for persons who suffer from brain and neck injuries, Alzheimer's disease, multiple sclerosis, and other conditions that involve a lack of mobility. While these conditions are long-term and progressive, sometimes bariatric wheelchair rental is appropriate for patients recovering from surgery or fractures. Mobility of bariatric wheelchairs prevents skin wounds. Caretakers must reposition the patient every 2 hours to minimize pressure points on the skin, which leads to skin lesions. Bariatric chairs are able to tilt, recline, and elevate the legs to change positions for the occupant. Seat tilt can change the patient's line of vision, allowing for his or her viewing of the surroundings and for communication with others. Tilting back slightly will aid in keeping the neck and head from dropping forward, but the angle of the hips and torso remain the same when only the seat is tilted. Padded wings in the back of the chair help with slumping, leaning, and poor lateral support. Reclining the back of the chair also allows a greater view of surroundings while opening the angle of the hips to the torso. Many skin pressure lesions are in the buttocks area, and distributing weight further up the back will relieve some of the pressure on the seat. A wheelchair with excellent range of motion. Repositioning also helps prevent contractures, which are the shortening of flexor muscles in the limbs, back, or neck. Range of motion exercises and stretching are two therapies that caregivers must perform on a patient several times a day. Bariatric wheelchairs are designed to support muscles so that contractures are lessened and give comfort to the patient. Bariatric chairs need to be comfortable to the patient and need to give the feeling of security to him or her. Some bariatric chairs may be fitted with gas shock absorbers to flex and adjust to uneven ground and to the patient's movement. Seat belts will keep the patient from falling or sliding and offer additional sense of security and safety for the patient. As mobility and ability to self-ambulate increases, as in the case of a surgery or fracture patient, the footrests on bariatric chairs may be removed, allowing the patient to pedal the chair with his or her feet. Bariatric chairs that are operated by gas cylinders are easier for caregivers to change the position of the chair. The chairs are designed to work in conjunction with sling lifts. With removable wings on the headrests and swing-away arms, transfers can be accomplished smoothly and safely. There's less strain on the caregivers when transferring a patient to and from a bariatric chair. Caregivers understand how important sensory input is to people who spend most of their time immobile, and a bariatric wheelchair can move patients around to where they can become part of their surroundings and social activities, be outdoors, participate in meals with others, and communicate with people. A bariatric chair can improve the quality of life for people with serious mobility issues. To find out more information on topics like this, please go to www.staxi.com.